Dear students, welcome you all to the fifth semester classes of pharmaceutical jurisprudence. Today we'll discuss about the Drugs and Cosmetic Act and the rules thereunder. The Drugs and Cosmetic Act is a very vital act as far
Dear
pharmacy profession
students,
is concerned.
today we will discuss about the drugs and cosmetic
And
act and the rules thereunder.
we have all the professional
So,
people should
welcome you to
know
the first
about
online
this act.
class.
Of course,
So,
this is a very big act and near about 40 to 50% of your syllabus comprised of this act. So basically, this act was enacted in the year 1940 with the parliament and 10th April. So we'll first go about the history of this act. So before 1940, there was no rule and regulation regarding the manufacture, sale, or dispense of drugs in India. So, in briefly in 1930, in the year 1930, by the help of Colonel R.N. Chopra, a drug inquiry committee was started, and he has placed many rule and regulation, and that things are approved in the next committee and placed before the parliament in 1940, and after passing the act in the parliament, every act has to pass by the parliament, and it came into force in 10th April as a drugs and cosmetic act. Then what is the objectives of this act? So the main objective of this act is that to regulate this import, manufacture, distribution and sale of drugs as well as cosmetics by a proper license. Without any license, nobody can import, manufacture, distribute, or sell any category of drugs. And secondly, the main objective is that it should be done by a qualified person. So later on we'll discuss who is a qualified person. And other some objectives are there to regulate some also besides allopathic, Ayurvedic, Siddha and Unani Ayush drugs. Mainly Ayush drugs, Ayurvedic, Siddha and Unani drugs are also controlled by this act. And other things is that by a highest body that is known as your Drug Technical Advisory Board, DTAB, and a Drug Consultative Committee, DCC, has been formed to control over the things related to the act of Drugs and Cosmetic Act. So in this topic, in your exam point of view, just I am telling, there are some definition are there. It will come in the examination, and you have to write down the definition whatever listed or written in the books, because from the I am telling from the beginning that it is a law subject. Pharmaceutical jurisprudence is a law-oriented subject, so we have to fight. Anybody can fight with law in any things related to this act. So by the line of by line, we have to go whatever written in this in definition. So let us consider what is a drugs. Define drugs. That will come in the exam. What do you mean drugs? So the drugs is nothing but all medicines for internal or external use of human beings or animals, and all substances intended to be used for or in the diagnosis, treatment, mitigation, or prevention of any diseases or disorder in human beings or animals, including preparation applied on human body for the purpose of repelling insects like mosquitoes also. So this is a brief definition of a drugs. That means that anything, whatever medication is coming under drugs, and whatever the additives, or suppose a capsule. Capsule is made of capsule shell and some drugs are there. So as per the definition, as per the act, capsule shell is also coming under drugs. So any additives to the preparation also coming under drugs. Any diagnosis, that is machineries for treatment, also it is coming under drugs. So next you can see what is a cosmetics. Again another things, what do you mean by cosmetics? Because cosmetics, they have been added in this chapter drugs because of this many unwanted effects came by using the cosmetics by the mainly group of ladies. So many skin problems, etc. is coming. So to standardize all these things in the drugs, the cosmetic also added in this act. So what is a cosmetic? Likewise, you have to do some. This is a definition. You can go through this and books, or that is your that chart. Cosmetic means any article intended to be rubbed, poured, sprinkled, or sprayed, or on your or introduced or otherwise applied to the human body or any part thereof for cleaning, beautifying, or promoting attractiveness or altering the appearance, and includes any article intended for use as a component of the cosmetics. So anything. So just you can understand the word, because this forensic, that is, or this pharmaceutical jurisprudential language is somewhat difficult. English language is somewhat difficult. You have to understand this thing. Sprinkled or sprayed, you can understand one type of. So any rub. So you so soap is coming under cosmetics, or any shampoo, etc. Any that is deodorant, it is coming under cosmetics. So that can be sprayed, that can be rubbed. For what purposes? In the human body, for cleaning, beautifying, or promoting attractiveness. You are using some different types of creams, lotion, etc. for your beautifying your bodies. So in that way, they have written this is the cosmetics. So whatever the things written in this curriculum, you have to, or books, you have to write down this thing. So likewise, many definitions are there. You have to go through some other definitions, some important definition I am telling. Misbranded drugs. So what is a misbranded drugs? A drugs without any brand, specific brand, because claiming other, that it is a colored or coated or powdered or polished, that damage is concealed, or if it is made to appear of the better or greater therapeutic value than it really is, or it is not labeled in the prescribed manner. Some misbranded, that means a drug of another costlier brand, you can make it duplicate like this thing. So for example, you can see this is some real brand, this is some fake brand. But you cannot just distinguish some manufacturers or some that is maybe our pharmacist may be involved something like they are preparing their illegal wars. They are preparing some fake medicines, and in the name of some good companies, they are making this thing. So this is known as your misbranded drugs. Next, adulterated drugs. So you know the meaning of adulteration. So anything can be adulterated. So that that means something mixing with this thing, and what it is not. It looks like, or it is, so it may be injurious to health also. So that is not adulterated. Anything your he is adulterated nowadays. So likewise, the drugs are adulterated nowadays. So that adulterated drugs may cause some harmful effect to their body. So that definition you have to go through this. This is also important for examination point of view. Next, spurious drugs. So spurious drugs means that is a one type of that actually meaning is that it is whatever written there you have to write, but the actual meaning is that it is a total imitated drugs. Total imitated means that means it is knuckly. What we are telling in our language we are telling it is not totally that is that in the capsule cell chalk powder will there. Suppose chloramphenicol capsule is there. Inside this capsule cell, some chalk powder is there. That means that there is no drug value will be there. When the patient will take for suppose chloramphenicol capsule, we are using for typhoid fever. So anybody is physician is prescribing that type of drugs for cure of typhoid disease. But if he is spurious drugs, then he is taking this simply capsule which contains calcium carbonate, chalk powder. So that is spurious drug, very dangerous drugs. Then now for that many rules are there, very strict, stringent rules are there regarding marketing of spurious drugs in the market. Next. So in this act, there are mainly two schedules. So one is first schedule. So what first schedule contains? Now, this as per the Act, there are two schedules. So you would remember first schedule, name of the books under Ayurvedic and Siddha system. All the books related to ancient India, that is Ayurvedic or Siddha system, are listed in first schedule. In second schedule, so what is there? Second schedule, the standard to be complied. What are the standards to be complied if you want to import a drugs, if you want to sell a drugs, if you want to manufacture drugs? So all the standards are listed in second schedule. So very important is your second schedule as per the Act is concerned. And for the examination point of view, many short questions will also come. This Drugs and Cosmetic Act 1940 and some rules are there. After 5 years, 1945, many rules came. So there are some schedules as per the rules. So alphabetical they have that is there in your books or in your that in chart you can see some important things you can discuss here. Suppose we will go for schedule B. What is schedule B? In the examination, it will ask schedule B. What is schedule B? If it is coming in the examination, 1 mark or like this thing, then you have to write down the schedule B contains rate of fees for test and analysis by CDL or government analysis. That means every drug before consumption of a patient or any man, it must be after production, it must be tested. Without test, it will not come to the market. If it is so, this test is done by CDL. CDL means Central Drug Laboratory. And by government analyst. Their government analyst, later on we will discuss about the role of government analyst, etc. So some certain fees are there. Any there are, suppose a private manufacturer, he has no facility of testing of the paracetamol assay, suppose. Then he can test it in a government laboratory by paying some fees. So for what drugs, how much fees has to be paid, that is standard given in Schedule B. So likewise, Schedule C is also important. Schedule C means when it will come in the exam, Schedule C, what is Schedule C? A list of biological drugs. All the drugs which are coming from biological origin, all antibiotics, or serum, vaccines. So they are coming under, for paracetamol. Paracetamol is not a Schedule C drugs. But suppose a penicillin. Penicillin is antibiotic. It is coming from biological sources. When the source is biological, that is coming under Schedule C drugs. So, because that why we are reading all these things, now later on we'll see what is there. And Schedule C1 drugs. What is Schedule C1 drugs? That is non-parenterals. Biological drugs are all penicillin. Penicillin injection is coming under Schedule C, but penicillin tablet is coming under Schedule C1. So what is giving in non-parenteral route, that is coming under C1 and coming under. So you have to remember biological drugs is Schedule C and C1. Only difference is parenteral or injectables, that is C1 is non-parenterals. Then some important definition like this thing, we can go for Schedule G drugs. Schedule G is important. All the schedules are there, but you have to choose some schedule. I will tell. Schedule G is important. That is in the tablet. When you will go to the market, you can purchase a strip of medicines. There is a caution mark. Schedule G drugs. That means these drugs can be used under the medical supervision only and labeled accordingly. Then one mark will be there. Schedule G drugs. It should be taken only under the advice of a physician. Schedule H drugs, very important. Schedule H drugs also important. All prescription drugs. That means when you will go to the shopkeeper, sometimes this shopkeeper is not giving to you medicine, because whose drugs are coming under Schedule H, that is given only by the prescription of a physician. Without, you can ask, you can give amoxicillin tablet, 10 tablets. They will not give. How virtually the chemist and druggist, now a scenario they are giving, but it should not be. As far as the law is concerned, it should not be. So all prescription drugs are coming under Schedule H. It is very important. Then Schedule M is important. Schedule J is important. Schedule J is, what is Schedule J? You can go through list of diseases or any ailments the drugs should not claim to cure. There are some diseases in Schedule J which the drugs cannot claim to cure. That means, suppose you are suffering from cataract. Some diseases are the cataract. You know what is cataract? So there is no such medicine which can claim. So any manufacturer or any stockist or any company cannot claim that this medicine can cure cataract. This medicine can cure appendicitis. Only appendicitis can be cured by operation only. Or cataract can be removed by operation only. There is no medicine still now developed to claim such type of things. Blood cancer, suppose one had. So in many diseases, night blindness, one diseases that cannot be cured. So likewise, many diseases they are kept in Schedule J. Then another important is Schedule M. So what is Schedule M? Now the M is the require for after passing your B Pharm, you will definitely join in an industry or pharmaceutical company. So for that, the all requirements for the manufacturing GMP, good manufacturing practice. What is the GMP? So for good manufacturing practice to run a industry, what are the requirements? That may also come as a long question. Later on, we'll discuss detailed features of Schedule M. That means good manufacturing practice, how to adopt in industry. And likewise, Schedule N is important. What is Schedule N? The list of equipment to run a pharmacy. Pharmacy means a store, druggist and chemist shop. So what are the requirements? Suppose after doing your B Pharm, you want to start a chemist and druggist shop. So what is the size of the shop? What are the instruments you have kept? Whether a refrigerator is required or anything else. So all list is also required or stated in Schedule N. Next, Schedule P, it is also important. So what is Schedule P? Schedule P is your life period of drugs. Every drugs has a life. So in the you see in the every tablet or syrup or capsule like this thing, there is a mark date of manufacturing and date of expiry. So that is how they are getting, how the company are getting. From their own, they cannot write this thing. So for paracetamol in the IP, it is mentioned many all drugs. What is how many periods? Maybe 4 years, maybe 5 years, maybe 3 years. As whatever as per the research, it has been come out. So that period is written in a book that is Schedule P. So they are following this thing. For paracetamol, life period is 5 years. For any other amoxicillin, ampicillin, azithromycin, it is 2 years. So when they will manufacture, after 2 years, they'll put the date. So every drug has a life period. So then, like this thing, so these are some important things, important schedules to the rules that will come in the examination. You have to go through this. So I have discussed many important other things. You may go through this thing, or you can left it. Another important also, another schedule X is there. That is also important. Schedule X and Schedule W also important. Schedule X is all narcotic drugs. All narcotic drugs and psychotropic substances. There is one act is there. I will later on I will tell about this act. So all narcotic drugs, heroin, morphine, codeine. So they are coming habit forming drugs. So many restrictions are there for this category of drugs. So they are kept in Schedule X. And Schedule W is a now that is a very peculiar things. Many drugs now the government is telling that should be given only generic name. There should be no brand name to it. Suppose a drug trazodone hydrochloride that can be given by the generic name only. You cannot give to the paracetamol is the generic name. Company may give Calpol, another Mapol. So like those things, some drugs are there for which you cannot give any brand name. You have to give the generic name only. So that category of drugs are kept in Schedule W. So this is all about the schedule to the rules. Now the main part of this act will discuss. So what is this act? I have told earlier that this act is controlling mainly three things. One is your import of drugs, other is manufacturing of drugs, and third one is sale of drugs. Then come to labeling and packaging also is there. So these are the three main things done or controlled by this act. So import any drugs which can be imported under a license. So drugs import or manufacture or sell, they should be under a license. So today we will discuss about import of drugs. So import of drugs, under that one thing is there, import drugs which are not available in our country may be imported under a license. So for that, what are the things we have to follow? So some point are there. Some classes of drugs are prohibited to be imported. This category of drugs cannot be imported. Imported for import of drugs, central government is entitled to give a license. No state government or any other authorities for manufacturing or sale, state government can give a license. But for import of drugs, central government is giving a license to deal with this thing. So under this, some classes of drugs are prohibited to be imported to be India. We cannot import this with a license also. We cannot import this category of drugs. For example, misbranded drugs. Any drugs which is misbranded, it cannot be imported. Drugs which are not of standard quality. If the quality standard of the drugs is poor, by testing it will be done also, then that category of drugs cannot be imported. Third is here, drugs claiming to cure schedule J disease. Okay? What I have told that we have to go for many schedules earlier. Now it will you can see. So I have told what is schedule J? Schedule J means some diseases are there. Suppose in India appendicitis cannot be cured by any medicines. But in America they have developed a medicine like that it can cure appendicitis. That category of drug also you cannot without any standards or without any claims, it cannot be procured to India, which it can mislead some some things. Adulterated drugs. Another thing, adulterated drugs. For that you have gone through definition. So adulterated drugs also cannot be imported. Spurious drugs, what I have told, imitated drugs, all that cannot be imported. And other things is that drugs which manufacture, sale, and distribution are prohibited in the country of origin. Suppose some drugs due to the adverse effect. Recently, you can know that thing, some diclofenac, that the government has banned some preparation in the country of origin. So that category of drugs cannot be imported into India. Those drugs which has been banned in India. Suppose paracetamol is banned today in India. You cannot import paracetamol from America or any other country. So this is country of origin. Other thing is that one patent and proprietary medicines. So in the definition it is there. Patent and proprietary medicine means a medicine which has been developed, not listed in the all the medicines are listed in the standard books. What are the standard books? Indian Pharmacopoeia, IP, British Pharmacopoeia, BP, United States Pharmacopoeia, USP. So all the drugs, their monograph are listed in that book of standards. Their knowledge book of standards. But some drugs are invented by the proprietor itself, a patent. So that category of drugs can be imported, but he has to disclose his true formula, because in the book of standards, that is other drugs, it is listed, But this is not listed in any book of standard. It is a very patent drugs. So the manufacturer has to give the total formula so that we can know this what content in this medicine. Then it can be imported. Otherwise, it will not be imported. Next. So these are the drugs prohibited to be imported. That's why it may become as a question to 4 to 5 marks. What are the drugs prohibited to be imported into India? And certain drugs, mainly drugs, in other chapter I will tell. Drugs are classified mainly Schedule C and C1 drugs. That is all biological drugs. Drugs other than Schedule C and C1 drugs, and drugs belong to Schedule X drugs. So the three categories, other categories are there, but basically you can go through this thing. Schedule C and C1 drugs, I have told earlier, that is all biological drugs. So it can be imported under a license to India. So the condition? So what are the conditions in the examination also it will come? What are the conditions a licensee must fulfill to procure biological drugs? Now that one is that he must have proper storage because because biological drugs can be deteriorated. So if proper storage condition he has to maintain, he has sale of all records he has to maintain. He must allow an inspector to inspect any premises, any records also he can see, and he can take inspector also can take the sample of the drugs for testing, but to identify it is a good quality or substandard quality or adult drugs like this thing. So these are some things you have to maintain for the import of biological drugs. Next. Likewise import of Schedule X drugs. So likewise same thing you have to narcotic or psychotropic substances. These are very harmful drugs, but can be used for some good purposes. So the licensee must have adequate storage facility, and applicant must be reputable in the occupation or trade or business. Any psychiatric medicine, that is some psychotropic medicine cannot be handled by a disbalanced person. So having trade business, sound business, he can do this thing. The license granted even before should not be suspended or cancelled. So the license has not been convicted any offense under the drugs and cosmetic earlier. So this type of things, if it is there, conditions are there, he can import Schedule X drugs. Drugs imported for examination, test or analysis. Also, some imported drugs, because suppose you want to assay paracetamol. For that, some chemicals reagent is required. Small quantity. So small quantity of reagents, which is not available in our India also, can be under the permission of the head of the testing authority. For this, license is not required, but head of the testing, suppose Indian Council of Medical Research, want for testing of some drugs, he need some ingredients of some sample of drugs. So it can be imported under the recommendation of the authority of this concerned authority. Next. Drugs imported for personal use. That is a provision is there. Suppose anybody is taking the drugs which is not available in India, it can be imported with a prescription only. But the restriction is that that is a for bona fide personal use only he can bring, and maximum suppose he is using tablets, so at a time 100 tablets he can bring, not more than this, and in second lot he can bring, but any doses, it may be tablet or capsule like this thing, so 100 not maximum more than 100 doses with a bona fide reason bona fide personal use prescribed by registered medical practitioner that that can be imported under the prescription. Next. So that is another category of thing is import of drugs without license also, because I have earlier told that a license is needed for import of drugs, but certain drugs which are there is exemption is there, like condensed powder milk, malt, though they are ingredient of some medicines, lactose, ferex, cereal, oats, like this thing, or that is some pre-digested foods, essence, chicken, ginger, cumin, cinnamon, etc. That type category of things also, though it is some coming under some medicinal values, can be imported without license. And some that is in last, but not least, we have to every act, if that is some thing is there for penalties also is there if you are not obeying the act. That means you are doing an offence. So penalties related to import. So anybody who is not obeying this act, he must be penalized. So that means he is doing an offence under this act. So anybody who is doing this, whatever I have told earlier, is not obeying this act, then he can be penalized with 3 years imprisonment or 5,000 fine on first conviction. First conviction means first, if it has been procured, he has been taken into account that he is doing such type of things, then that is punishment is there. In subsequent, the first time it is there, second time the imprisonment is rigorous, 5 years or 10,000 fine or both. It can be given. Wrongly. There is no 1,000 is there, not 1,000, it is 10,000. So this is the main provision of this thing. Other thing is not needed. So today this is all about the import of drugs. First chapter, unit one. So please see to it whatever the earlier note I have given, and you can go through this. Thank you. Thank you all. That is